Welcome back, friends. Today we'll be talking about the common abnormalities of tongue. It's a quick synopsis, and I hope it will be helpful to you in your exams. Before going ahead, please subscribe to this channel and click the bell button. This is the list of conditions which we'll be discussing today. The first one is Encyloglossia. You all know it's tongue tie. It's one of the commonest of all the developmental variations of the tongue, and it may also be associated with Macroglossia. The treatment of Encyloglossia is frenectomy, that's we cut the frenum there, and it has seen that there is significant breastfeeding improvement following this division. Next is macroglossia. Macroglossia means the tongue has been enlarged. There are various reasons, and we can categorize them as congenital or acquired. Congenital is seen in Down syndrome, Hurler syndrome, Beckwith-Wiedemann syndrome, benign tumors like lymphomas, and in acquired, it's like acromegaly and amyloidosis. So these are the conditions in which macroglossia is seen, and maybe the surgical reduction of the tongue may also be indicated in these cases. So it may be this severe. Next is Fischer tongue. So what happens is there is deep fissuring of the tongue. It's actually not pathological in itself. In most 3% of the cases, it's very normal. But because the fissures they are deep, they may harbor the pathogenic organisms and give you the symptoms. It's common in Down syndrome patients than normal ones. And this is specifically attached to Melkerson-Rosenthal syndrome. We just said that macroglossia was seen in Beckwith-Wiedemann syndrome and Fischer tongue is seen in Melkerson-Rosenthal syndrome. So what is it? It is deep Fischer tongue when seen along with recurrent facial nerve palsy and the swelling, okay, of the perioral area. So this comprises Melkerson-Rosenthal syndrome. The treatment for this is reassurance for most of the cases, and it's if it's because of the syndrome, there should be referral to the hospital, to the specialist department. Then is hairy tongue. Etiology is not known for the hairy tongue, and what happens is there is elongation of the filiform papillae, and there may be abnormal pigmentation. It's commonly associated with smokers and the people with poor oral hygiene, and the one with hyposalivation. So, hairy tongue, it responds to podophyllin paint, a thorough scrape, eating pineapple chunks, sucking peach, lemon, plum stones, and or surgical shave. So, this is how it can be treated. Next is geographic tongue. So, this is the inflammatory condition, but etiology is again not known. It's seen in 1 to 2% of the adult population. What happens is there is rapid appearance and disappearance of the atrophic areas with wide demarcated borders on the dorsum and lateral surfaces of the tongue. So this gives the appearance of wandering lesion or moving around the tongue surface. Okay, this atrophic area is because of temporary loss of filiform papillae. All right, and familial pattern is seen in this condition. Psoriasis is also associated with it, and the histology is similar in 4% of the cases, and treatment is just reassurance or as found in etiology. Then is glossodynium. Glossodynia means sore tongue. So it may occur in presence or absence of the clinical changes, and the main causes of glossitis are iron deficiency anemia, pernicious anemia, and candidosis. So these are the conditions which may be associated. So its treatment will be to treat the underlying cases. This is all for today. I hope this was helpful. Stay tuned, keep watching. Good luck, guys.